I talk a lot about micro skills, those small intentional actions that create big impact. That's the focus of Micro Skills, Small Actions, Big Impact, a business and leadership book about transforming your work and relationships through simple, deliberate practices that anyone can champion. Whether you're leading a team, building your career, or navigating everyday challenges, Micro Skills help you show up with more intention and effectiveness. This holiday season, Micro Skills is available at all major booksellers, including Bookshop and Amazon. You can get it in hardcover, ebook, or audio. Small actions, big impact. This is the Visible Voices podcast. I'm your host, Dr. Resa Lewiss. Audience, today's conversation started in Philadelphia. I attended the 2025 TED Democracy Speaker Series entitled Truth, Trust, and the Media. Enter Dr. Claire Wardle, one of the world's leading experts on misinformation, media literacy, and public trust in science, who was a visible voice in that speaker lineup. Claire Wardle is an associate professor in the Department of Communication at Cornell. She's spent decades working across sectors, including as an academic at different universities in the UK and in the US, working with different international news organizations such as the BBC, as well as the United Nations, and advising policymakers. In 2015, Claire co-founded the nonprofit First Draft to provide practical guidance on finding, verifying, and publishing content from the social web. It expanded into an international partner network before closing in 2022. That same year, she co-founded the Information Futures Lab, a multidisciplinary research lab based at Brown University's School of Public Health. Check out her 2019 TED Talk, How You Can Help Transform the Internet into a Place of Trust. This has had over 2 million views. Claire's expertise lies in studying, educating, and advising on the growing challenges of misinformation and information inequities, viewing them as significant threats to public health, economies, and democracies. Claire, welcome to the Visible Voices podcast.
Thanks for having me.
When I started reading about you and looking at your work, it is cross-sector. It is many industries coming together, and one in which we meet is public health. You have talked about gun violence. You have talked about vaccine hesitancy. Speak more about that intersection of your communication with public health.
Well, to be completely honest, I've been studying how do we know what's true on the internet since 2007, when the BBC said, we're getting content from the audience and we don't know what's true or not. And then, of course, 2015, 2016, 2017, everybody was obsessed with democracy. Then around 2019, I started seeing some measles outbreaks in New York City and state. And I was like, hang on, what's going on here? And started thinking much more deeply about kind of anti-vax sentiment online, studied what was happening in the Philippines with the rollout of the dengue vaccine, and then also looked at what happened in Pakistan around the polio vaccine. And so before COVID, I was becoming obsessed with the ways in which false and misleading information around not just vaccines, but cancer cures, weight loss drugs, you name it, all over the globe. Actually, the much bigger problem was about health and science. The foundations, the conferences, the headlines were all about democracy. But I was like, actually, this is really, if we look globally, much more about science and health. And so then COVID happened. And of course, everybody became obsessed with misinformation and health. But to me, what we saw with health is also similar to democracy, is also similar to economics, is also similar to personal well-being. So I think, unfortunately, academic disciplines sit in silos. This is a problem that shows that we absolutely need to be crossing our disciplinary boundaries.
2018, the Washington Post named misinformation its word of the year. Misinformation is false information people share not knowing they're causing harm. Disinformation is false information that people create and share, and they know it's false, and they're sharing it intending to cause harm. A third term, malinformation, is genuine information where the sharing is trying to cause harm. And an example would be like leaking emails, or you've mentioned revenge porn.
Yeah. I just talk about misinformation for a second. It is people who don't know they're causing harm, but they also don't know it's false. And so actually that's our biggest problem. The number of people who knowingly create false information is relatively small. The bigger problem is all of us, and I say this is a human problem, all of us then, without realizing for many different psychological factors, share that unwittingly, not knowing it's false, and often not meaning any harm whatsoever.
AI and information certainty, can we ever be 100%?
No. No, and particularly in the space of health and science, I think and I say we as people who were kind of in this space trying to provide people with accurate information, what we did a terrible job of was discussing this concept of unsettled science. And so sometimes we know, that the sun will rise every day. There are certain facts that we can all agree on. But actually, a lot of what we know is unsettled until there is consensus. And even then, consensus can change. And so I think, particularly around science, partly because science literacy isn't as high as we would like,
Mm,
people don't necessarily understand this idea of, if I publish an article, I can never prove anything. I can only disprove something. I'm building on knowledge. I'm trying to replicate, but I can never prove something. And I think those concepts and ideas haven't been widely spread, which is why people say, well, is this true or false? And you're always like, oh, it's kind of gray. There's some data. And then people switch off
yeah.
because people want the simplicity and the certainty.
And there's many examples of something getting published in a peer-reviewed scientific or medical journal, and then all of a sudden it's been falsified, the data wasn't accurate or was manipulated, and then there's so much work done to try to disprove or reverse. And I think one of the obvious is vaccines and autism.
Yeah, I mean, was the Lancet, not the British Medical, but it was a British journal, basically in 1999, publishing Andrew Wakefield's claim, later retracting it. But as we know about corrections, they don't travel as far as the original claim.
Yeah. Why do you think it's so hard to reverse that information or to change the culture once that information is out?
Well, I'm not an evolutionary psychologist, but this is all our brains, which is we like certainty, we like clarity. And once somebody tells us something, it's very difficult for us to reverse course. So, in our training, we used to use this example of if somebody you get food poisoning, or you have, and you have just eaten at a restaurant, you're absolutely convinced that it's that restaurant. And then maybe the next day you find out that there was actually a tummy bug going around, but you're still probably going to avoid that restaurant. I mean, we just are kind of set up to kind of have beliefs, and it's very difficult to move us from those beliefs, whether it's serious or frivolous. And so when it comes to misinformation, there's all of this great research, which is even after you fact check something, people 2 weeks later are like, I can't really remember, like the kind of no smoke without fire thing. So it's important that we fact check. It's important that we have an accurate record. But as humans, we are terrible at changing our minds.
When people come to you and say, Claire, what should I do? What should I believe? Where should I go? What do you advise people?
So I'm going to step back a second to say, we also have to acknowledge that because of the internet, it has allowed us to hear voices and stories that we otherwise wouldn't hear. But it has also allowed us to find stories from people who look like us that are really convincing. And as human beings, we are drawn to stories. And if you see somebody telling you a story of their baby as they're holding the baby who's crying, and they're telling you what has helped their baby, or they talk about their father who had cancer and the diet that they were on, and their dad's cancer was in remission, that is so incredibly powerful, so much more powerful than the text-based PDF or the 3,000-word long read in the Atlantic, or, the press conference from the person who's got, many, many degrees but struggles to talk in a way that people can understand. The disconnect between stories from people who look like you versus the way that we wrap expertise, which is often distanced, objective, uses a certain amount of, certain terms and language. We love data, we love facts. And that's not actually how our brains operate. And so what we see today is people being pulled towards those on the internet who are telling them what they want to hear versus, institutions that people are less likely to trust today for a whole host of reasons that we can get into. But that's why we're in this moment of crisis right now.
And it brings back in this concept of siloing of academics versus not academics. And sort of one of the many ways that you have established expertise and credibility is you haven't just been in the walls of the academy, as you say, of academics. You've actually done field work. You've been in the local places doing the education with journalists, for example.
When I look back over my life, the times I've spent in industry or with communities have been so much more valuable than the books that I have read. The books that I have read have given a sense of overarching theories and other things, but fundamentally, the innovation comes from people in the field who have problems that they're trying to solve. So particularly around misinformation, I watched all sorts of nonprofits actively trying to protect their community and learning in real time what worked and what didn't work. Did they have time to do a rigorous evaluation? No, they didn't have the money to hire an evaluation specialist. They didn't have the skills necessarily. So what I would see is somebody doing something excellent in a small corner of the world, but nobody else knew about it because it hadn't been evaluated and so it hadn't been written up and so it wasn't scaled. But we also saw some people failing, but those lessons also weren't shared, right? So then you see other people replicating what I had seen and thought, well, actually, I don't think that's going to work again. And then in the academic setting, there are some excellent misinformation scholars, but I'm sure they wouldn't mind me saying that a lot of misinformation research is done in laboratories with undergraduate students in large Midwestern universities and then written up in journals. And ultimately, what can we say? Did this work or not? Well, it worked in that laboratory condition. Oh, when we went back 2 weeks later and some of the effects had stayed. But I mean, that's not real life. So what I would love to see is a recognition that innovation happens in the field and ways to support that. I mean, even when I was running a nonprofit, we were doing a project where we were using text messages in Kenya as a way to try and teach people about misinformation. And we were trying to get somebody to evaluate that. And when I talked to some, different academics, I'm like, oh, that will cost 40,000. I was like, I don't have 40,000.
Right.
I'm a nonprofit. So what would it look like to pair up? I'm not the first person to talk about this, but I would love to see more established partnerships between those who can evaluate and people in the field so we can learn what's working, but also what's not. Absolutely what's not. That's just as important.
I love your attention to human-centered design, and that's like a whole thread I want to go to. But I'm wondering, can you give an example of one of those community success stories of one of these innovations or success stories that didn't make it because it wasn't published in some journal?
It's a really great question. I mean, I saw particularly people in communities, for example, I'm not going to name the nonprofit, I haven't asked for consent, but they on every Wednesday evening would do these sessions with their community members. And I remember being asked to talk at one of these sessions and it was a July 7 o'clock. I was like, who on earth is going to be on Zoom? And there were 500 women from across the US turning up, connected with each other, really excited, really wanted to learn, wanted to know what they could take back to their communities. And it was all about building resilience against these issues. And they were sharing examples with me. I was giving them kind of like textbook examples of like, oh yeah, well actually last week, blah, blah, blah. And it was this rich space that I just, I thought nobody was ever going to fund me to do something like that because ultimately these networks exist organically and they are happening and there's amazing power there. But again, how can we connect and partner with experts who can either bring additional knowledge, but never coming from a place of like, I've got the answer. I learned so much more from them. And so, I mean, we did another project actually when I was at Brown University in South Florida, where we worked with a community group, We Are Mass, with Spanish speaking diaspora communities. And we identified 25 information navigators. And they would tell us every week what their communities were concerned about, what questions they had. And we would give back answers, but we didn't have the Brown University logo.
Sure.
We would empower the navigators to be the messengers, right? But we tried to scale that, get more funding. And the funders were like, I just don't know how that's going to work in practice. It was like the networks already exist. We don't have to build something new. And so sometimes there's some of my frustrations, but yeah, there's great innovation happening at the community level.
Why is human-centered design so very important? And it makes sense to you and to me, but not to everybody.
It's hard because I think when it makes sense to you, you just think, well, why doesn't everybody do it? I mean, I think it goes back to some of the siloed thinking. I mean, I spent a lot of time in newsrooms and I'd go in, talk about the audience, and you could just tell that there wasn't a lot of respect for the audience, right? It was like, I've got a story to write. I'm going to write that story. I hope it gets good page views, but really I've got a story to tell. And the idea of like reading audience comments or, people are, oh, what have people got to add? When, as we know, a huge amount is added by people who really have deep lived experience and expertise. And so to me, there's two reasons for starting with community, which is like, why on earth would you spend all these resources to build something that in the end, the community's like not interested or more importantly, offensive or actually you didn't understand the problem that we have in the first place. So you're solving for a different problem. I mean, all of that to me seems straightforward, but I think unfortunately, there's just too much arrogance from too many people with too many degrees that they have the answers. And so when they do go to the community and it doesn't work out, then it just gets notched down to, well, I didn't get enough money or, there's never nobody ever says, well, you didn't start with community. That's why it failed. Like we don't say that loudly enough. And that's often the reason.
Bringing this together, these are two Claire quotes, everyone has an emotional and not a rational relationship to information, and trust is local.
Yeah. And I think that I've said both of those things. And I think everything is emotional. Again, going back to training, as somebody who works as I am a researcher. I've spent time in newsrooms. I've spent time in government agencies. We are never allowed to talk about ourselves. Our language has always got to be distance, third person. We can never have emotion. But that as humans is how we connect, right? And it's about stories. Fundamentally is why people are drawn to communities. There's a reason that they're called online communities, because they turn up, people ask how they are, they help solve their problems. It's just they're sometimes using tools that I wish they weren't using, right? But you can't deny that people locally, and that's either physically locally or locally in the sense that they are connected around a shared interest or issue, that you are more likely to trust the person who's like, hey, how are you? I haven't seen you for a while. How have you been? I've been thinking about you. That is a really human response versus you go to a scholarly lecture and the person is at the front behind a podium. And if you're lucky, they might have 5 minutes at the end for Q&A. I mean, we don't listen. We don't listen, and we sure as hell don't hear. And that is a reason that so-called trusted institutions are struggling, and why online communities, even if it's not based in fact, are thriving. Because it's that connection that's driving people to go there again.
Tying together then sort of this distance, we don't show emotion, we don't put ourselves into it. I mean, this is how we are trained as physicians. And yes, we are storytellers. We're often receiving stories of patients, but also, we sort of publish in these siloed places that public mainstream audiences may not have access to. However, you've really pushed back on this, and I agree with this pushback. Physicians and social media and telling the stories on, for example, TikTok or Instagram. What are your feelings on this, and how can this be a successful way to de-silo and get misinformation fixed?
We have to be where people are spending their time, right? I mean, so many people now go to their social feed of preference and they either just consume information there or they might go out to something that's linked to. But the days of going to a website that you have pinned at the top of your browser is very, very rare now. So we can't say, well, look, we've got a new page on the CDC if people don't come to us and it's their problem. Like that, we can't think like that. So we have to be where people are. And the internet is increasingly visual and video based. It just is. Journalists and academics and doctors, we love Twitter, we love Blue Sky, we love text, right? Most people are over on other platforms watching videos or listening to audio. The internet has fundamentally changed from a text-based space, but too many people who have been trained with a number of degrees have been rooted in text and they don't want to do video. But we absolutely have to be in those places and we have to tell stories in those places. You can't turn up on TikTok and read from a script. You've also got to be authentic. And just yesterday, actually, I saw a new initiative from the Children's Hospital of Philadelphia that is actually doing two things that are interesting. One, they are asking pediatricians what they are hearing from their patients as a measure of issues on a weekly basis that people might have questions about, which is kind of genius, right? If parents at the school gate are all asking about, I don't know, a vitamin supplement or a new vaccine, that's going to come through to the pediatrician, and the pediatrician can then, at an aggregate level, say, listen, we're hearing a lot more parents talk about X today. And then they've got a website, which I went to, I'll admit, but they have embedded all of these YouTube shorts of just really engaging, but not over the top, not like your dad dancing at a wedding, but just like really nice design, simple, short, engaging, and based in fact with whoever's doing the speaking wearing scrubs, which we know we need those heuristics. Will everybody trust that? No, but CHOP is a really good place to start and to model some of this. So I was really excited to see them do some of this kind of, again, innovation. And I hope to see other people modeling that.
What would you say? What would you advise for people that are sort of considering jumping into social media and using their voice and their storytelling in this way?
So the first thing I'd say is get an account and just watch and listen. Because I actually did a project with a student at Brown University around misinformation related to the RSV, kind of RSV in general and the rollout of the new vaccine. And what she found is there was all of these videos of mums in the middle of the night crying, like hugely emotional, very compelling. But what she found is there were doctors and nurses who were doing their own videos. But what she saw was more effective was doctors and nurses in the comment sections of videos that were spreading misinformation. being like, hey, that's interesting. Actually, as somebody who, like, I've had 6 cases this week, here are the things that I'm trying. Like, so not like you're wrong, like using empathy, saying, I know this is really scary, however, and so sometimes you don't have to be the person in front of the camera. You can also be creating comments in other spaces. So I say to people, watch, lurk, see what other people are doing, see the stuff that you're like, ooh, that does look like your dad dancing at the wedding, see the stuff you're like, wow, that's inspiring, and recognize that everybody can have a voice. And I think there's a place for everybody in these places. It also, unfortunately, we live in a world where you can also yourself up to harassment. So I also say to people, don't wade into these spaces unless you've watched for a while and understand some of the words that are going to cause people to get angry at you. Be part of the community before you wade in.
Yeah, you've highlighted, I think, exactly some of the reasons for the hesitancy. Is there training available? Can people get training on how to do this?
It's a great question. When I was working in a lot of newsrooms were very good at things like digital security and were very good at making sure that their correspondents and journalists had this training. I actually don't know whether health departments are doing this for their staff. I hope so. I mean, after the horrors at the CDC recently, there has to be a moment where we wake up and say, healthcare is under attack. And for the people who step up to do this kind of work, they need additional protection. I mean, even like, for example, I have all of my personal information scrubbed from the internet. I have a service that does that. Like those kind of things, if people are going to be out there, it's important that they themselves and their loved ones are not made vulnerable, unfortunately. And there are tools that you can use to do that.
Do you recommend that people generally do that, like scrub their information on the internet?
Yeah, I would say, well, for many reasons. I mean, I'm European, so I find it astonishing that I could come to this country and basically search for anybody's telephone number, address, how much their house is worth. I mean, all the things that in America it's just out in the open. There's a good reason why you just don't want that information out there for, privacy. But secondly, I do think in this moment, unfortunately, you never know how people can target you. And I just do not think it's a good idea for people to have their addresses and their emails and their telephone numbers out there, unless you're happy to. But I think people need to be a little bit more savvy about the information landscape we live in.
Do you think that's actually an epidemic of over trusting? Or like, why do you think people sort of miss out on the importance of being careful with address, phone
Because
number being out?
the world has changed very, very quickly in a short space of time. And I also think we didn't necessarily do a good enough job of explaining to people how much information was being shared. I mean, I remember back in 2008, 2009 at the BBC, having to work with foreign correspondents who were going to country. This was actually before Syria, but I remember correspondent going to Syria in 2011 and uploading photos of food he was eating. And I was like, well, the metadata shows exactly where you are right now. He was like, really? I was like, yes. Turn off location. So I think we used to live in a world where people didn't necessarily know the kind of like the technical elements of what their phone could do. And it didn't really matter as much then. Now, unfortunately, it does matter. So people need to be savvy about what the technology can do, and also, unfortunately, aware that people can use that information if they want to.
I've spoken a lot about the personal board of directors and who sits on your personal board. And I think everybody would love to have a Dr. Claire Wardle like on their board, giving them info and coaching about social media savvy and media training. You mentioned that we all need training in this, and, maybe the physicians and other healthcare professionals that want to get into the space or in this space may not get proper training. Maybe some are. On this podcast, I've covered episodes, for example, on personal finance, and there's a big push to get coursework in public education. Same thing. I have a strong feeling about preventive medicine, nutrition, and lifestyle behaviors to help not get to the point of the chronic diseases that many Americans live with. So similarly, I've heard you speak about this need for just generally everybody to have media education and literacy as a lifelong learning as the social media and World Wide Web evolves.
Yeah, I mean, I think on a number of issues, but specifically around mis and disinformation, when you say to people, this is what's motivating disinformation actors. Sometimes it's power and influence. Sometimes, a lot of times, it's financial. Sometimes it's just to see if you can get away with it. And let's really think about those motivations and how that might play out. Because once you understand what those motivations are and how they show up, like, I know that you're really worried about your new chronic illness. And I know that you've just found this website that seems to have this magic answer, but let's just have a look at the website together. Like, I want to help you find an answer to this, but like this guy is selling like 20 different supplements. And like, let's just go and do a lateral search and like go to Google and like search for this guy and then search for those supplements. Oh, look, BuzzFeed did an analysis and these are just all the same as like, washing powder. Like, once you start doing that and getting people to say, this is why they're doing it, they're trying to make money. Let's look at their tax return. Like, the minute you start to do that, it helps people not feel like they're being stupid. Like when people go, well, you're wrong. Like, why would you think that, you idiot? Well, of course, nobody says, oh, thanks for fact checking me. They double down on their beliefs, right? So
Right.
I'd always talk about financial scams. Like when you say to your nana, hey, like
Yeah.
you're getting a lot of these letters, like you don't ever say, nana, you're an idiot. You're like, these people are preying on you and trying to take your money and I'm here to help you. Like you're not blaming nana, you're showing her the system that is making her vulnerable. And the same is true for mis and disinformation. And the same is true for polarization. At the local level, people are connected over problems they're solving, the ways they connect through their children or dogs or church or sport, whatever. It's the national level that makes everybody feel like we're so impossibly divided. Well, when you say to people, well, the media is in the media's interest to push polarization. It's in politicians' interest to push polarization. But look, think about your street, think about your neighbors, think about your farmers. So it's helping people understand the structures to show this is why the world looks a certain way. But like, let's get at that structural element as opposed to making you feel like you're an idiot.
Yeah. Claire, what keeps you up at night?
I am very concerned about the ways in which personalized AI chatbots are going to impact people's mental health and actions and behaviors. And I think it's not like, oh my goodness, robots are going to kill us all. I just think we know the impacts of social media when they're designed to keep you addicted. They're designed to keep you on the site. They give you emotive content designed to make you feel something. We already know the harms caused by that. Well, times that by 1,000 and you have the AI chatbot that tells you that you're right all the time. And, oh, what a great idea. And here's all the things that you need to know. And seeing that terrible case last week that was reported on the child that had taken their own life. And when you looked at the chatbot transcripts, how is that okay?
Yeah.
Why do these companies not have to have mandatory reporting guidelines?
Yeah.
Facebook and others have been struggling with suicidal ideation for, 15 years now and who allowed OpenAI and others to be like, oh yeah, you probably don't have to worry about these issues. It's 2025.
Right.
So that the stuff that keeps me up at night is the absolute absence of guardrails at a time where we now have almost no regulatory oversight and no appetite for regulatory oversight. That's what worries me.
You have definitely interest in medical issues and in public health, and you've published on this, you speak about this, you've referenced quite a few on today's recording. Now, granted, like we've established sort of the medical overlaps, but where does this interest in medical and public health come from?
I think it's from spending a lot of time in communities. I mean, I'll be honest, my PhD is in communication. I don't have a background in public health. And then in 2021, I was asked by the Brown School of Public Health to come and, take a position there. And I was very honest. I said, I'm not a public health person. And they said, well, we've realized how important it is that we embed information and communication into the work that we do. And the minute I stepped foot into that school, I was like, oh, this is what I care about. This is what I've been doing. I just didn't call it public health. I thought about it as working deeply with communities. I understood information as the gateway, social determinants of health. I was like, oh yeah, that makes perfect sense. Like the way the information fits into all of these. So yeah, it's funny that I've sort of found myself here without necessarily having a label on it. And I think the truth about communications as a discipline is we've always picked, you can do health communication, political communication, environmental communication, personal communication, organization. So I think it's part of the discipline to be so interdisciplinary. But my time in public health as a discipline, I absolutely loved.
Your voice. When did you realize you had a voice, and when did you start using your voice?
Well, you'll probably love this. So I did American Studies as my undergraduate degree, and then I was very, very lucky to get a scholarship to go to Penn, and I was in the political science program, and I cried myself to sleep every single night. I was like, I'm reading all of this, and I've got anything to say.
How
I'm
many how
stupid,
many nights
imposter.
how many nights in a row?
Oh, the whole semester, as far as I can remember. Anyway, halfway through the semester, an amazing woman, Professor Gottschalk, took me to one side and said, why do you never say anything in class? Because I was very, very, very shy. And I said, I shouldn't be here. The Americans in the class are so clever and they're so confident and they talk and I haven't got anything to add. And she said, quote, well, most of them are just bullshitting, right? And I was like, what? And she said, your written work is good. You need to learn to speak out. And that as a professor, I think about, sometimes I have conversation. I think, I wonder if somebody will remember this in 20 years time. But she gave me the confidence to go from a very, very, very shy British person to, I think America changed me. And I'll just say that it gave me a confidence and an ability to recognize that speaking can have a big difference. And sometimes you just have to find courage. And the more I spoke and the more I realized that I was making a difference, the more I did it, fortunately or unfortunately.
What's giving you hope?
Communities. 100% communities. I just did a charity event here. I live in Ithaca, and it was called Women Swimming, and it was women swimming across the lake together. And when you spend time with people, solving problems, raising money, helping each other, that is why this world is, will be okay if we let people themselves drive what happens to the planet. We just have to get these. Well, anyway, we're not going to go there, but I think everybody can understand right now that the beauty in the world comes from communities and how they work together. And we have to find ways to empower those communities and to tell those stories. Just, we started here. So much innovation and beauty happening every single day. It just doesn't get reported by newsrooms who need bad news headlines. It doesn't get shared by funders because it's like, oh, well, that problem has been solved. It's like, how can we lift up those voices and those examples? Because that is happening every single day, not just in America, but around the world. If you'd read the news, you wouldn't know any of that. You just see what's wrong.
Moreover, I want to use the word moreover as a transition word right there. In terms of being a part of a community, the studies that look at not just lifespan, but actually health span, it's the people that feel like they have a purpose and are part of a community. And so it's actually a part of health.
100%. And the UK, I think in 2015, was the first country to have a minister for loneliness. And not only does it help with health outcomes, but also in terms of building resilience against misinformation. We know the people that are more likely to be drawn to conspiratorial communities are people who are lonely. And, there's research or reporting around QAnon believers who often would say, oh, I work night shifts. I'd log on, everybody else was asleep, but my QAnon community was there for me. Absolutely, we have to see strengthening communities as a key element across a whole host of issues. And I think if we did that and invested in it, we would be much better off. But it's, again, not sexy. It's not immediate. Like funders want things that are immediate and the bright new shiny thing, and it has to be shaped like AI.
I think that you could not have brought together misinformation, health, communities, and storytelling any better. Claire, for listeners that want to follow along with your work and see what you're up to next, what's the best way?
Well, I used to be much more active on social media. I have to admit that I have been less so recently. But yeah, I'm on Blue Sky, and wherever possible, I try and write articles that are accessible. I'm on podcasts, but yes, Blue Sky is probably the best place to find me.
The Visible Voices podcast amplifies voices in the healthcare, equity, and current trend spaces. Our team includes Dr. Giuliano DePortu and me, Dr. Resa Lewiss. Find me at Resa Lewiss MD on social media or visit thevisiblevoicespodcast.com. Find us wherever you listen to podcasts and watch our episodes on YouTube. This podcast is for education and entertainment purposes only. The views and opinions expressed by our hosts and guests are their own and do not reflect the opinions of their institutions. Information shared here should never substitute for clinical judgment or for medical advice. Together, we're making healthcare more equitable, one visible voice at a time.